So how was the framework actually developed?
Oh, there was so much. I mean, research, scanning the data, right? Getting very clear on what the literature was telling us about the factors in our work environments that contributed to better psychological health. We did a scan of best practices, and at that point, very limited, but the health and safety executive in the UK had been very progressive at that point. They had a management standard frame. The American Psychological Association had a frame for psychologically healthy and work environments. As we kind of scanned what the literature was telling us, took a look at those best practices, and in particular HSC and APA. And then Dr. Martin Shain was our legal researcher and scholar that was very connected with what the case law at that time was telling us about the factors that organizations had to pay attention to. And we took all of that and then we combined and distilled it into what, a couple of years of work that took us to get there, but distilled it into 13 different unique yet overlapping and not mutually exclusive factors. And so things like clear leadership and expectations. We know when we have clarity about what we're to do, when our one-up that we report to provides clarity on what's expected of us, we thrive, right? If we know what to do and what we're supposed to do and when we're supposed to do it, we thrive. And so that's just one example of a number of the different work environment factors that we pay attention to. So that got us down to 13 and created the frame.
And how did you settle on the 13? Was there a bit of
Yeah, good question. Well, it was a very methodological approach that we took, right? Was that we've found ways of coding and seeing what things had commonalities, and we were trying to put things together, kind of doing a little bit of a factor analysis. And I say little bit in that it wasn't, at that point, there's very little research that actually looked on work environment factors. So we had to be very creative. And there was an element too, because this is for organizations and it's not a research study kind of off on its own, that it also had to be very practical and it had to make sense to people. And so when we think of the concept of clear leadership and expectations, all of us, without knowing what that is, will know what that means, right? If we say workload demands, right? All of us will know what that means. And so there was also a very heavy eye on making sure that this had high face validity and was making sense. So we went through lots of consultation, great people at a national level, at Sapna, who you've had on your show, from the Mental Health Commission of Canada. Marianne, of course, was pivotal in leading this work. We consulted with employers, large employers, small employers, human resources, health and safety, union. We had focus groups with employees and workers that were dealing with issues. So we took a very comprehensive methodological approach to making sure that we were understanding perspectives and concerns and the kinds of things again and again that came up.